Hi, Dr. Jen. I'm here. I'm a reproductive endocrinologist, and I'm here to talk about IVF over the age of 40. So this is technically going to start at 6:30. So give me 2 minutes to get this started. And then we'll get started. Okay, so for anyone who's joining, Dr. Jen, I'm here to talk about IVF over the age of 40. So I'll be answering questions too, so please let me know if you have any questions. Why is that in my camera? I don't know. I'm so sorry. I don't know why that is on my camera. I'm very sorry about that. Hi, I'm Dr. Jen. I'm a board certified reproductive endocrinologist and fertility doctor, and I'm here today to talk about IVF over 40. And I'm not sure my live is working, so let me see. All right, I think it is. Okay, so I'm here today to talk about IVF over age 40. So IVF over age 40 can definitely work, but it's important to have your IVF personalized once you're over age 40. Um, and like over aggressive protocols, I've seen many times not work for women over age 40. So then they think that IVF cannot work for them, but actually they just needed a more personalized protocol. Because when you're over age 40, your egg supply is lower, and aggressive high medication protocols don't work as well. But that's an older, more standard way to do IVF, but it's important to have a personalized protocol when you're over age 40 for IVF. So after age 40, two things decline. What happens is your egg supply declines, as well as the normal how well the egg works, or the chromosome number after it fertilizes, that also declines steeply after age 40. So we talk about that as egg quality. So it's egg quantity, but also egg quality after age 40 that decline. So again, I'm Dr. Jen. I'm here to talk about IVF over the age of 40 today. Please let me know if you have any questions at all, and I will answer them in a Q&A at the end. Yes, please let me know if you have any questions. I'll be answering them at the end. I'm talking today about IVF over the age of 40. So it's not that your good eggs disappear over the age of 40. It's just that it can be almost like harder to find them because you don't have as many, so you don't get as many eggs per cycle. And those eggs that you get, they don't work as well. So you do have good eggs left, but it depends on if we can find that good egg during IVF. So IVF can recruit eggs. We can always collect eggs as long as you're getting regular periods. That means you're ovulating, as long as it's not because of birth control or other medication. But if you're getting regular periods on your own without medication, that means you are producing eggs. So we can collect eggs, and then the eggs fertilize and grow into embryos, and we can check those embryos for correct chromosome number, which allows us to check for viability to see if the egg that we got during IVF, it has a chance at viability. So that's what we're able to do. For many women over age 40, because over age 40, your egg supply is lower. So what that means with your hormones is it means that your AMH is lower, and it means that that your FSH is higher and your antral follicle count, or the group of eggs that you have each month, is smaller. So again, this isn't to mean that it can't work. It just means that you really need personalized protocols. So gentle IVF works better over age 40, which is personalized to your own FSH, instead of high dose stimulation. That medications used in standard IVF are injections of the hormone called FSH. But if your own FSH is naturally very high, which it tends to be over age 40, injecting a lot more FSH isn't that helpful. So what you need is a personalized protocol that pays attention to your natural FSH levels. And this will work a lot better over age 40 for IVF. And then, is there anything you can do to support the egg quality? Because that's really what the big issue is over age 40. You know, it's not an easy fix with egg quality. There are some supplements that may help, which is CoQ10, especially if you take it up to 3 months before your IVF cycle. That shows some promise for improving egg quality. I like to make sure that my patients all have sufficient vitamin D levels, especially during winter. A lot of women have low vitamin D. And so you want to make sure you're taking a vitamin D supplement if your vitamin D is low, because lower vitamin D will possibly lead to poor IVF results. There are other supplements like DHEA, which shows promise in low egg reserve. NAD is a popular one right now. So these show promise, like resveratrol. These are supplements that show promise. They don't have as much evidence behind them, but they may help with egg quality. Again, it is a hard thing to fix, but having a healthy weight, a healthy Mediterranean diet with healthy fats is good as well. The other thing that may help with egg quality is ovarian PRP. So that's where we take a blood draw, spin it down to get what's called your plasma, and put that into each ovary like a month ahead of an IVF cycle. So I will recommend that to some of my patients over age 40, especially if they've had poor outcomes with previous IVF cycles. These are things that may help with IVF in women over age 40. But the biggest one, honestly, is to have a personalized protocol that's not overly medicated, not too high and heavy doses of injections. That is key. And what else can I tell you about IVF over age 50? So IVF over age 50, over age 40, because you don't have as many egg follicles in what's called your antral follicle count, because your AMH may be lower or your FSH may be higher, then you don't get as many eggs at one time during IVF. So that, and then the eggs that you get, they don't work quite as well. So IVF over age 40 is pretty common, not all the time, but it's pretty common that it might take more than one egg retrieval to get that good egg that fertilizes properly and will grow into a healthy pregnancy and a baby. So it's not that you can't get there, but I always tell my patients that it can take more work. So it might not be a one cycle and done. It may be you need to do 2 or 3 egg retrievals to get an egg that's a good enough quality to result in a viable embryo and, again, a healthy pregnancy and baby. So IVF is maybe not just one time and done when you're over age 40, but can take more work. It can take more time to get there. So that's an important thing to know about IVF over age 40 as well. And so I'm Dr. Jen. I'm here today talking about IVF over age 40. And let me know if you have any questions about this. If you're over age 40 and you have done IVF, let me know how it went. And if you have any questions about IVF over age 40. So let me scroll through and look for some questions here. Thank you everyone for joining. And let me see here. Okay, I start IVF tomorrow. Any tips? I have endometriosis and have not had surgery yet. Just a 3 millimeter endometrioma. So that's a small size for an endometrioma. What that is endometriosis growing on the ovary. So that can decrease your egg quality when you have endometriosis growing on your ovary. Doesn't mean you can't get pregnant. You can. I've had lots of patients with endometriomas go on to get pregnant, but sometimes what we see is the egg quality is not as good when you have an endometrioma, so that you may expect, depending on your AMH, because the endometrioma can also lower your AMH, but depending on your AMH, you can get sometimes fewer eggs, or eggs are not as good quality. So it can take a little bit more work, just like IVF over age 40. It doesn't mean you can't get pregnant, but it can take a little more work to get those good quality embryos that will result in a healthy pregnancy. So that's something that's important to know about endometriomas and endometriosis during IVF. What are the overall stats? So the stats vary a lot depending on 2 things. One thing is your AMH level, because your AMH will let you know, and this is stats again for 1 cycle of IVF, but often it can take 2 or 3. But if your AMH is higher, you'll likely get more eggs in 1 cycle, so it may take fewer cycles. The pregnancy rates are much higher at age 40 than they are at age 44. It's very dramatic between age 40 to 44. So at age 40, I would say most of my patients get pregnant with IVF. At age 44, that drops off, where most of women don't get pregnant with IVF at age 44. Some do, but not most anymore, because that you see such a dramatic drop in egg quality between age 40 to age 44. it's a very dramatic drop. So that's the overall stats, if I could give them. But again, it can take more than one egg retrieval, maybe like after 2 or 3 egg retrievals, especially as you get to 42 or older. And some women don't have those good quality eggs anymore, even starting at age 44. So, okay, so I'm Dr. Jen, and I'm talking about IVF over age 40. So let me know if you're over age 40 or if you have any questions about IVF over age 40. That's what I am talking about today. Let's see. Okay, good luck with your third transfer. Let's see. I'm going for IVF in April. Which medication is good for egg quality? So egg quality, it's different issues over age 40 as compared to PCOS. PCOS is a hormone imbalance that can cause issues with egg quality. So you might want to look at inositol for PCOS, but that is a different issue than for women over age 40. So I'm 41 and 3 embryos, I think, but PGTA and none were good. Okay, that can happen. That's that issue that I'm talking about with the egg quality, basically. So the egg fertilizes, but it has abnormal numbers of chromosomes, which makes the fertilized egg or embryo not as viable. There's a few things to know about this, is that you want to definitely take a close look at the results, because there can be some that are labeled as abnormal, but they're also mosaic, or they don't have a whole chromosome problem and they still have a chance of pregnancy. So take a close look. But if you're having whole chromosome problems, that likely means the embryos have very low viability. But and it depends how many cycles you've done. So sometimes, again, at age 41, it can definitely take more than one egg retrieval. And you want to start looking into things that can improve the egg quality. Make sure your supplements are good, and make sure that if you've done more than one cycle of IVF and are not getting correct chromosome embryos on testing, you want to consider like ovarian PRP to help those eggs work better, because you are getting eggs. We just need them to work better to get an egg that has the correct number of chromosomes. AMH 1.55, I think at 40 and a half. Okay, I mean, that's a good AMH for age 40. The AMH, I mean, at age 40, your AMH is going to be a little bit lower. So overall, that's a little bit lower AMH, but normal for age 40, which is good. But it does drop off quickly after age 40. So I would just say move quickly into fertility treatment if you're considering that. But I would be happy with your age and AMH doing IVF. Let's see. Okay, so I'm talking about IVF over age 40. So if you have any questions about that, let me know. And let's see. I have any questions? Should I have an SIS? This can apply to over 40 as well, but yes, generally an SIS or saline sonogram. I just did a video on that, so check it out. That's on YouTube. Actually, that one's on Instagram, so check that one out if you're curious. And yes, but a saline sonogram is a check on the uterus. So it can pick up your uterus is usually closed, and that will open it up so you can look at the lining. And that's really important because you want that uterus to be perfect after you've done all this with IVF for the embryos. It also lets us track the curve of the cervix so that when your embryo transfer comes, it's very smooth. So I do recommend that. I'm 42 on my third IUI. Okay, because you're over age 40, that in itself can be an indication for IVF, especially if you've done 3 IUIs and you're not getting pregnant. I would definitely consider moving to IVF because it works a lot better and you don't have a lot of time when you're at age 42. Chances of IVF working at 49, very low. Most women have trouble getting pregnant with their own eggs. after age 46. But at age 49, there are fertility treatments like donor eggs that work really well as long as your uterus is clear. Donor eggs have a high chance of pregnancy, but pregnancy with your own eggs, the chances are very low. Are you automatically a high-risk pregnancy if you're over 40? I think that by OBGYN, they do consider you higher risk, yes, if you're over age 40. Let's see. So I'm talking about IVF over age 40. So let me know if you have any questions about that. Does grading 40-year-old who has 3 embryos, and does grading influence viable embryo? That's a good question, really good question. So grading is when the embryo grows in the IVF lab. The embryologist will look under the microscope and let us know what it looks like. So the first number is how big it is, like 3 is how big it is, what's made it to blastocyst, and then they look at the cells and give them in your case, a letter, like A is the best, B, then C is the one that is not as clear. It turns out it doesn't tell us that much, which is why PGTA testing has become part of the reason PGTA testing has become so popular, because it turns out embryos can grow for 5 or 6 days and look really beautiful, but still not be viable. And so if you're not doing PGTA testing, then we base the chances of viability at your age. So at your age, I would expect 1 out of 3 or 4 embryos to have viability, even if they're graded well. So that's something to keep in mind. But congratulations on getting about 3 blastocyst embryos. That's great. That's a great place to start. No, IVF will work at age 42. Yeah, usually will work at age 42. It's like you have to have a personalized discussion because it depends on your egg supply, I will say. I've had some patients with really low egg supply at 42 where it can be tricky, but most women, in my experience, still have egg viability at age 42. So IVF can work at age 42, yes. What are IVF stats for recurrent miscarriage at age 40 plus? So recurrent miscarriage is usually due to this problem, basically this issue, if you want to call it egg quality or how well the eggs work, because when the eggs make mistakes, they make mistakes in chromosomes. But those embryos with all abnormal chromosomes can implant and actually grow in your uterus for a few weeks. Then they miscarry. So most miscarriages are because these embryos have abnormal chromosomes. So IVF can screen for those abnormal chromosomes through PGTA. So it can really decrease your chance of miscarriage. It doesn't bring it to 0, unfortunately. I wish it did, but it can really decrease your chance of miscarriage in your 40s. So yeah, it is helpful for that, because you're asking for the stats. So if you go through IVF and get a screened embryo through PGTA, then the chances of pregnancy are about 50% per euploid embryo, and the chance of miscarriage is about 10% or less. So it does decrease the chance of miscarriage, and it works for a recurrent miscarriage. Okay, so I'm Dr. Jen. I'm talking about IVF over age 40. So if you have any questions about IVF over age 40, let me know. Okay, let me see. So I think I answered most of the questions. I hope that the connection was stable here. I'll give it 1 more minute to see if anyone has questions for me. Or any questions on YouTube. I'm streaming there as well. And I don't usually get many questions there. So if you have any questions, just please feel free to let me know. And I'm talking about IVF over age 40. So I think I'm not getting any more questions here on TikTok. So basically, IVF over age 40 is a viable option for many, many women. You want to pay close attention to your AMH and make sure you're getting a protocol that's personalized to you, your age, your AMH, your egg count. That is really, really important over age 40 and plays a big part in the success. So please follow me, subscribe on TikTok and YouTube, and ask me questions because I love to answer questions, so please feel free to ask me any questions. I just got a whole lot more questions come in, so let me see if I can answer. any more of those. So I am located in New York City. I also do virtual consults or second opinions if you have any questions. And there'll be a link in my bio, hopefully in this next week, so you can schedule those appointments. But I am super specialized in IVF over age 40 and also very difficult IVF cases. I've helped hundreds of women over age 40 become pregnant through IVF, and also with really difficult IVF cases who weren't able to get pregnant other places. So definitely seek me out so I could look at your case and give you personalized advice, because again, it's so important over age 40 to make sure the advice is personalized to you when it comes to IVF and fertility. And you really need a personalized IVF protocol. It's so important for success with IVF over age 40, because those heavy medication protocols, they don't work for so many women. Okay, let's see. So I'm 40 and I had a ruptured ectopic. I'm sorry you went through that. I know that's so scary when that happens. And how long should I wait to do IVF again? So if you had a ruptured ectopic, sometimes you'll have surgery. I'm guessing maybe you had surgery for that. You don't always have surgery for that, but maybe you did. So after surgery, you want to wait 6 or 8 weeks before doing IVF again. You don't want to push it off too long, because you're losing that really good egg supply and egg quality, which you can't get back, but you need to give your body time to heal. Let's see. My AMH level is 0.557 at 42. Is it low, and is it possible to get pregnant naturally? It's possible to get pregnant naturally. That is a low AMH. We see that AMH at age 42, but it's low. So if you wanted, you may have a chance, but you also, if you wanted to do everything you could to make sure you could have a baby at age 42 with that AMH, I would definitely consider IVF, because it's a very your fertility is very fragile. Like, you wouldn't want to spend months trying on your own, because that AMH will just continue to drop and be harder and harder each month to get pregnant. So you can get pregnant naturally, but it can be hard, and you can lose a lot of time trying to get pregnant naturally. I guess that's the main point. Okay, I'll try to take last question or two. Thank you everyone for all your questions. Dr. Jen, I'm talking about IVF over age 40, low AMH and perimenopause at 35. Should I go straight to IVF? Yes. I don't know what your AMH is, so I guess I would say, let me see what your AMH is so I can tell you for sure. But yes, I think so. If you're in perimenopause at age 35, again, you don't have time on your side. What is on your side is your age, because at your age, the eggs are better quality, but with perimenopause, it can be really tricky. So you need someone who's familiar with protocols for really low egg reserve. Make sure that's really important to have those personalized protocols and not the heavy medication protocols, because those won't work. Okay. Do I take patients from the UK? Yes, I have had patients from the UK before. Absolutely. Okay, well, thank you everyone for joining. Thank you so much for all your questions. Oh, I just got so many questions. Okay, let me see here. PGTA, which is the test that we do on the embryos to check their viability. It checks chromosome number. How long does it take to get the results? Depends on the lab, but in my experience, 2 to 3 weeks. Okay, 44, my AMH, I think, is 0.85. Can I get pregnant? That's a good AMH for age 44, but at age 44, I know based on your age, the quality is really low, so it could be tricky for you to get pregnant, because the eggs are going to make mistakes when they go to get fertilized, and it will be, it's possible, but it's just your fertility is low because of that. So it's possible, but you don't want to sit on it, basically. If you want to get pregnant now, I would say, or freeze your eggs or embryos, because you will lose your fertility very quickly. Okay, so thank you guys all. I'm talking about IVF over the age of 40 tonight. So let me know if you have any questions specifically about that topic. let's see, my AMH is 0.015 at 35. So that is low at age 35. You definitely would want to see someone very specialized in low egg reserve. And if you're considering trying to get pregnant with your own eggs. But it is possible, but it would be tricky with your AMH being at that level. Okay, so I'm Dr. Jen. I was talking about IVF over the age of 40. So thank you all for all your questions. And I know I always get a lot of questions about IUI, so I will consider doing a live on that one in the future too, to get everyone's questions about that answered. And also recurrent miscarriage is another topic I get a lot of questions on, but maybe leave me in the comments if there's any topics that you would like to see in future lives. I'm going to be doing those regularly throughout the month. So please let me know if there's any topics you would like to see on lives, and I'll go over and cover them for you and answer your questions on them. Let's see. Okay, so some questions about getting your fallopian tubes removed. When you're doing IVF and you have an embryo transfer coming up, if you had fluid or some problem with your tubes, it can actually increase your fertility or the embryo implantation rate to remove your tubes. So if you did that, and then one patient is saying she has a donor egg embryo PGT tested, so that's great. If the other checks on your uterus are have been clear, I would expect a very high pregnancy rate. So good luck. And for one donor egg PGTA tested, I'm going to say 60% pregnancy rate without knowing anything else about you, but that's what I would say. Okay, so thank you all for all your questions. Let me know any other topics you want me to cover. And thanks again for joining. Every time I'm trying to hop off, I get more messages. So, okay. Let's see, but thank you everyone for joining. Stay tuned, check out my channel for my next live. I'll be doing these regularly. So if you didn't get your question answered on this live, be sure to hop on my next live early next week. I'll be announcing it over the weekend. And I am happy to answer all your questions. And thank you again for joining.